Hi, this is Brittany McKinney here, looking at our alcohol disorder assignment for the week. And I chose to make a video over some of the notes that I did over the assignment. So I'm going to be kind of looking back and forth on my screen about our prompts that we need to be going over. On the first question, it says, what signs and symptoms did the client or therapist address that led to the diagnosis? Um, Originally, I did kind of make some of my own notes during the assessment phase. And I kind of just wrote down some of the markers and criteria that I seen or heard while they were doing the assessment. And then later on, whenever they did the recap from the therapist at the end of the session, some of the symptoms that they did mention for a diagnosis was that, his drinking wasn't pleasurable there at the end. And he was also able to not do it at the beginning and then had a substantial amount of time to where he was like, yeah, I'm not going to drink anymore. But then there was that like aha moment, especially like with this individual's like Bloody Mary moment. I wrote down it's called the Bloody Mary era, because it seems to be whenever they found that substance of choice, their alcoholism just kind of escalated from there. So they did kind of talk about, the trying to quit on their own and not being able to, the severe consequences of the alcoholism coming from like the cirrhosis of the liver, the replacement, needing the liver replacement. And then, his consequences was a slow progression from slow consequences to higher consequences in moderation. And then there was also some strong biological cravings that would meet some of the DSM criteria for an alcoholism diagnosis. There was also some mentions of some blackout periods and kind of some personality issues in between drinking and who they were when they weren't drinking and what kind of alcohol allowed them to do. And so I'm going to further talk about that in my next diagnosis questions. It asked, what differential diagnosis would you consider for this client? I believe that, um, you know, just a generalized anxiety or generalized depression could be considered for this gentleman based off of his description of, just kind of not having a lot of satisfaction without drinking, or even the anxiety of who he is without alcohol, and kind of that facade that alcohol created for him to be able to go out and do more extroverted activities, that can kind of go parallel in course with the anxiety of not being able to just show up as yourself without a substance. After the differential diagnosis, we were asked the questions, if there could be any comorbid diagnosis attached with this gentleman's assessment. I believe that there could be a mood disorder attached to his diagnosis, and I kind of went with the social anxiety disorder. Individuals with the social anxiety disorder, they often avoid situations that it's going to cause them like discomfort, or that can like significantly impair like their activities while they're there. And, this gentleman talked a lot about almost like image protection. Like he believed that drinking certain cocktails would make you appear like you had more money versus being like the normal junkie that drank out of the bag. So I saw a lot of image complexes from this individual that I would like to look into, having a little bit of the social anxiety of just not being able to show up authentically of who you are outside of, how the alcohol creates your image to be. And there was also a mention of there being only performance only criteria of the social anxiety disorder. I don't believe that we have enough markers to distinguish if it was going to be anything more than performance, just based off of some of the social factors that we've learned from this assessment. But also, he did mention too, needing to drink at 5 or 6 a.m. because of a physical dependency. I think that can kind of go in line with performance because without the substance, they're not able to show up. The next question says, what specific techniques do you want to remember from this therapist style to use for your future practice? I really like how, well, I just kind of skipped a beat. I believe that the therapist they were asking us to kind of look at was the initial therapist that was in the assessment. I like that he mentions using a psychoeducational modality later on with somebody that is a little further in their recovery, because during these analyses they may have a lot of triggers that they may not be able to overcome in the beginning. And so in the beginning I do like that he did kind of use more of a motivational interviewing, kind of allowing the client to unveil like the information that they wanted to disclose without kind of going through that psychosocial assessment of all of like the small criteria. I do like that it was more of a open-ended question dialogue that allowed the client to kind of control the dynamic of like what they chose to share. Granted, this client seemed to be pretty open and willing to talk about where they were at in their process. So I know that's going to look a little bit differently than with somebody that may not be there where they're at that change process that client was at in the assessment. And then, what, if anything, would you do differently in the assessment to arrive at a diagnosis? I didn't see basically like any assessments, like I guess I could say similar to a PHQ-9. I would probably need to look up what this was called right now. So you're gonna have to forgive me for not having the name of the substance use assessment, but we could do a substance use assessment and kind of base off the criteria of like what their markers are, because I believe that the DSM does it in 3 categories: mild, moderate, and severe. And so I would kind of like to get a baseline to where, the client maybe considers their substance use. However, we don't really know where they are within their process of treating this client. So that may have been done and being monitored. I don't have that information. And then it says, what would you do differently to arrive at a diagnosis? Um, I would also like to dive into a little bit more of this client's history, kind of, their childhood, how can we apply the relational theory to, kind of the way that this client grew up, because I would be really interested to hear where some of these ideas have been implemented as far as like the drinking and the society status, and kind of like just what was their upbringing, to kind of understand if there's any more underlying issues that the alcoholism is masking. So, yeah, I think that I would just try to use the tools that we're learning during these assessments and kind of just look at it in a holistic way. And that brings me back to a point that I forgot to say a while ago. Um, Going back to like studying the therapist in this assessment, I really liked the therapist. His name was James Menegay. I know I slaughtered that, but he talked about how you have to treat a dual diagnosis patient as a whole. And we may hear about holistic training or treatment all the time, but the way that he broke it down, I really liked the example. He said basically, you have the body and we have the head of a client, and the left arm is the addiction/disease, and then the right arm would be, their dual diagnosis, whether it's their anxiety or their depression. But you have to treat the body as a whole to keep it functioning. So I really liked that image of dual diagnosis, especially if you can't really wrap your brain around like how you have to correlate the two. I do hope that this was an overall assessment of the alcohol assignment that we had for the week. And I look forward to any feedback or tips that you can give me to further my knowledge on this area. Thank you very much.